Hello everyone. I'm Tori Matajoski. I'm with Great Northern Development Corporation in Wolf Point, and I'm going to be your room host for this breakout session. So we're excited to have you all with us today. Just a reminder to please mute your lines and use the chat function for questions. And the presenters have asked that you please be patient, and they will answer those chat questions during the question and answer session at the end. I think it's the last 10 minutes they've got set aside for that. So shoot them in the chat and then we'll get later. And then just a few housekeeping items. The sessions are being recorded. Please be sure to mute your, when you're not speaking, mute your lines and turn your video off. I'll try to manage that too. It's kind of tough when there's a lot of presenters. I don't want to accidentally mute a presenter. So please try to remember to mute yourselves and ask that you turn your video back on during the question and answer. So each of you should have received a whiteboard paddle and a marker in the mail. If you find something inspiring, exciting, or new, write a quick adjective on the whiteboard, hold it up, and let us know during the Q&A time at the end of the session. So now I'm going to turn it over to the presenters and yeah, have a great session.
Welcome everybody. Let me get the PowerPoint up and going here. Is everybody able to see the slide?
Yes.
Okay. So we'll go down the list of presenters here really quick just to have everybody introduce themselves. My name's Travis Hoffman, and I'm the Advocacy Coordinator at Summit Independent Living based in Missoula. Bronwyn, you want to go next?
Sure. I'm Bronwyn Troutman. She, her, hers. I'm Community Living Specialist at Summit Independent Living in Missoula.
Go Allison.
Hi, I'm Allison Alvarez. I use she, her pronouns. I have glasses and curly brown hair. I'm wearing a brown sweater with an office background.
And I'm Shyla Patera, and I use she, her pronouns. And I work at Nichols in Great Falls, and I use a power chair. I'm a short lady with brown graying hair and glasses and jean jacket today with a pink sweater on.
You want to go Charles?
I'm Charles. I'm wearing a driving cap, a black and white checkered shirt with a green vest over it, and my background is a scene from La Push, Washington, where my wife and I spent our honeymoon.
And it looks like Anaya.
Hey all, my name's Anaya Robinson. My pronouns are he, him. For visual description, I am sitting in my living room with white walls behind me, wearing a white button-up shirt, glasses, and have short, dark brown hair. And I am the Associate Director at Atlantis Community, which is the Center for Independent Living in the Denver metro area down in Colorado.
Thank you all. All right. So the title of our little session today is Accessible and Affordable Housing During and After the Pandemic. So we're going to talk a little bit about what Centers for Independent Living do, some of the importance behind accessible and affordable housing, especially as it pertains to people with disabilities. And we're going to kind of get into kind of what the centers have been able to do during the pandemic and how the pandemic has really shined a light on the housing or lack thereof of accessible and affordable housing, specifically as it pertains to people with disabilities. So Centers for Independent Living are primarily advocacy and resource centers for people with disabilities. We were able to connect people with different community resources, assist people in self-advocating, skill development, different things like that. Montana has 4 centers for independent living. The first being Living Independently for Today and Tomorrow, which is shown in blue on the map. They serve, I believe, around 17 counties in southeastern Montana, from Stillwater County to the North Dakota, South Dakota border, and all along the Wyoming border. Montana Independent Living Project, which is shown in orange on the map, serves, I believe, 14 counties in southwest Montana. They're headquartered in Helena. North Central Independent Living Services, shown in yellow on the map, serves north and northeast Montana, from Glacier County to the North Dakota border. And Summit Independent Living, serving 7 counties in western Montana, headquartered in Missoula. So centers for independent living, or independent living centers, as people often refer to them, it's important to note that these are not places that people live. We are non-residential services. We provide services that assist people primarily to live as independently as possible, and encourage people to have choices in where they live. And so we're not a place where people live. And that's often a big misconception that the general public typically has about centers for independent living. So what is independent living? It's a program. I kind of went into a little bit of what we do. We provide information referral services, direct services for consumers, and systems advocacy type services, where we try to influence policies and programs and different things to make sure that they are inclusive of people with disabilities, and that the needs of people with disabilities are met through policymaking and on all different levels of government, as well as in the private sector. Independent living is also a movement comprised of people with disabilities advocating for people with disabilities. And the independent living movement really got its start way back in the 70s, with people like Ed Roberts and Judy Heumann and Wade Blank, and a whole lot of people who saw a system that was, or systems that were really rooted in the medical model, where people with disabilities were viewed as the problem, and we needed to repair people to fit into a non-accessible society. And the real premise behind the independent living movement is a social model where disability is a natural part of life. Everybody is going to have an experience with a disability, whether it's yourself growing up with a disability, acquiring a disability, or facing some of those disability challenges as we age. Everybody's life at some point in time will be touched by disability. And so the move behind the independent living movement is to make society accessible and accommodating and inclusive for people with disabilities. And it's a culture. Disability is not something to be ashamed of. It's not something to hide. And it's something that to accept and accept as a natural part of the human living experience. And so Centers for Independent Living are community-based, cross-disability, non-residential, nonprofit organizations designed and operated by people with disabilities. And they're unique in that they operate according to that strict philosophy of independent living, which is consumer control. People being in charge of their own lives and being at the forefront of making decisions about their own lives. And so all Centers for Independent Living have 5 core services. Those are peer support or peer mentoring, information and referral, individual and systems advocacy, independent living skills training, and transition. And transition is really broken into 2 areas: youth transition, assisting youth transitioning out of high school and into adult life, whether that be they're pursuing employment, or post-secondary education, or just being able to live as independently as possible. And the second part of the transition service is nursing home transition and diversion services. So ensuring that people can live in the place of their choosing, and be in control of their own lives. Nursing homes are quite expensive, and many people who go into them on the premise that they need 24-hour care. But nursing homes are really so full and so understaffed that nobody there really gets 24-hour care. When you go into nursing home, choices of what you can do out in the community are pretty limited. And so we really strive to educate individuals on what's available in the community and bolster those community services so people do have the opportunity to pursue their life's goals, whether that be having a family, being able to socialize with friends and family, pursue employment, pursue education, whatever it is. Community services are really a priority for Centers for Independent Living. And so just a little bit of numbers across the country, there's 403 Centers for Independent Living and an additional 330 branch offices. And one thing that all states that have Centers for Independent Living, what they must have are statewide independent living councils. And so that really guides each state's independent living goals and kind of lays out how independent living services are provided throughout each state. Some of the higher level national laws that relate to housing that really support people's rights to live in the community are the Supreme Court's Olmstead decision. And what the Olmstead decision did is upheld the ADA's mandate that people be served in the least restrictive setting possible. And so if somebody absolutely is not needing to be institutionalized, they have a right to live in the setting of their choosing. So a person's treatment professionals can determine the community supports are appropriate. The person does not object to living in the community, and the provision of services in the community would be reasonable when balanced with other similarly situated individuals. The Fair Housing Act. What is fair housing? So fair housing means that you and your family have equal opportunity to choose where you live, depending on whether you're able to pay rent or mortgage without being discriminated against or treated differently than other people. And there are 7 protected classes. So there's race, color, national origin, religion, gender, disability, and familial status. And by far the greatest number of fair housing complaints that fair housing offices get are generally related to disability. So fair housing requires landlords to provide reasonable accommodations and modifications for people with disabilities to successfully live in rental locations, and prohibits them from really discriminating on the basis of disability from renting to people with disabilities. It also requires that multifamily housing units that have 4 or more units be accessible to people with disabilities. We have Section 504 of the Rehabilitation Act that prohibits discrimination on the basis of disability in federally assisted programs or activities, including federally subsidized housing. And then more relevant to COVID, and COVID really shined a light on the lack of affordable and accessible housing that is truly available for people with disabilities. The centers, and we'll get into this a little bit later, so I don't want to go too much into this. The centers all received some CARES Act funding to assist people with disabilities to remain independent and remain in the community and whatnot during this pandemic. And by far, a majority of the referrals and services that we provide had to do with housing. Not getting into that too much further as we'll go into more detail and just go ahead and move on. Money Follows a Person is another program that really benefits and solidifies people with disabilities opportunities to live in the community. And what Money Follows the Person is a federal program that states could apply for, and Montana did. It began as a 5-year grant award, and the goal of it is to shift Medicaid long-term care services from institutional care to community-based services, where people have greater choice in what they do with their life, as well as where services are not quite as expensive. Money Follows a Person is the longest running demonstration project in the history of Medicaid, and has resulted in the transition of thousands from institutional settings into the community. The goals are to increase the use of home and community-based services, decrease the use of institutional long-term care services, increase the utilization of self-directed services in home and community-based programs, increase the availability of affordable and accessible housing, and demonstrate the effectiveness of the Money Follows the Person program. It really has been great for Montana. One of the fallbacks here in Montana is this is really meant as a systems change grant, but where Montana spends $0 on housing subsidization, Montana is really behind many other states when it comes to being able to offer truly accessible and affordable housing. Over the pandemic timeframe from March 2020 to 2021, Montana has only transitioned 6 individuals, and only 6 individuals 65 or older, 5 with qualifying physical disability, and 2 with severe disabling mental illness. So was that 13? And only out of those 13, only 7 of those were able to stay out of an institution for more than a year. So when it comes to community supports and affordable, accessible housing, Montana has some work to do. Luckily, there is a new funding opportunity coming up, and I believe Montana is applying. The deadline to apply, I believe, is at the end of June of this year. And so Montana will be applying, I believe, for $5 billion. And one of the big things that opportunities that we have through this new funding is to really start to build a partnership between the Medicaid program and Montana's housing programs. And our hope is that this new opportunity will really lend itself to figuring out how we can get some more stock of truly accessible and affordable housing. And so I just want to put in a little plug here that if people, if you work for case management services or any other human service agency, and you know of individuals who are institutionalized and want to get back out in the community, to go ahead and make a referral to DPHHS for the Money Follows the Person. It used to be that people had to be institutionalized for 90 days or more to qualify, but that has since been relaxed to 60 days. So hopefully we can get more people qualified for that program and transitioned out into the community. So why is affordable, accessible housing needed? So when people can't access housing, for many people with disabilities who need personal assistance services or whatnot, they're at risk of being institutionalized. And being institutionalized takes away pretty much everybody's freedom to travel as they please. It can also lead to people staying in houses that they can't get around in. And so they risk further injuring themselves through an increased risk of falling. They become more isolated because they can't get out of their house to get into the community, or they're at risk of homelessness. Also, people with disabilities live on, many live on very restrictive and low incomes. The standard for 2021 SSI is only $790 a month. So imagine you only get $790 a month. Like the price of housing nowadays, you wouldn't be able to afford that. And when it comes to subsidized housing, which we'll get into here in just a little bit, without that and without accessible housing, many people with disabilities just simply couldn't afford to live in the community. Housing affordability has done nothing but increase quite substantially, even through Montana. Just in the past 2 years, Cascade County, the median house or rental fair market rent for a 2-bedroom apartment has increased 4%, Yellowstone 6%, same with Missoula County, Lewis and Clark County 10%, and in Gallatin County a whopping 22%. The other benefit of having accessible, affordable housing is that it decreases Medicaid costs. When people live where they can safely conduct their activities of daily living, get around their house, it lowers medical costs. 2016 study found that there was a 12% overall decline in Medicaid costs for people when they were able to access affordable and accessible housing in the community. Another important factor of accessible and affordable housing is that it allows people to age in place. So when somebody's aging and they can't get around as well, or they have severe disabling conditions, oftentimes they've lived in a house that's not accessible. So they either have to find an accessible house, put costly modifications on their home if they can afford it, or they need to move into an institutionalized care setting, such as a nursing home or an assisted living. So making sure that we have housing that can meet people's needs will allow people to stay in the community longer and be able to access whatever they want to do in the community. So yeah, the population of people with disabilities and people who are aging is not going to get any smaller. We have the baby boomer generation who's now becoming more in need of services to allow them to continue living in the community. And so, yeah. Is Vern on yet?
I haven't seen him come on unless he's under a different name.
Next.
Okay. So Vern Anderson is a person with a disability who works at Living Independently for today and tomorrow. And he was just going to share his experience with becoming institutionalized due to breaking his leg. He had to go to the hospital. And from the hospital, because of his disability, they wanted him to go to a nursing home for while he recovered from the broken leg. And so in doing so, while he was there, he developed some stomach issues and had to have an additional surgery, which meant he had to be institutionalized again. And while he was institutionalized, he ended up losing his housing. And so he was looking at being institutionalized indefinitely. Luckily, he had some strong supports in the community, and his mother was able to find him an accessible apartment, which is pretty rare and it doesn't happen very often. But it's a typical story of somebody who kind of goes into a situation and has to go to a nursing home or some other type of institutionalized care setting, and they end up losing their supports in the community. And when they want to get back out, they're either subject to long waiting lists or the lack of affordable, accessible housing. So they have nowhere to go. And it really shines a light on why it's important to ensure that housing is not only affordable, but also accessible. But yeah, he was able to finally get back into the community. And so now that he's back in the community, he's employed and is able to do all the things that people in the community do. And with that, we'll turn it over to Allison to talk about community-based living.
Yeah. Hi, guys. Well, I'm Allison Alvarez. I'm the Quality Assurance Specialist for the Self-Direct Program here at Montana Independent Living Project. And I'm just really happy to be at this conference today, sharing on this panel with other independent living specialists. Like Travis said, our jobs are really to help support people with disabilities living in the community. Centers for Independent Living have a lot of interesting services. One of the most important are our transition services, youth transitions, helping youth transition into adulthood, finding out what their interests are, where they want to live, what their goals are, and then nursing home transition. And really that job of ours became really important over this past year, especially with COVID-19. It really spread through nursing homes quick, like wildfire. The New York Times came out with an article that said 1/3 of all deaths in the United States were related to nursing homes. And Montana fell in suit with that. And so, you know, when we get calls at our desks that of people wanting out of these facilities, we got to get to work. And really, housing is number one on that list. We got to help people figure out where they're going to live. Affordable, accessible housing is key. So it's a long-term solution for people. The second thing we start looking at are services that will help support people in their homes and in the community. And personal assistance is a big one. People with disabilities sometimes need day-to-day help in their homes in order to be successful. And so some of the programs I'm most familiar with are Medicaid-based. And so if someone has Medicaid and a need for personal assistance, they're eligible. However, if someone doesn't have Medicaid, there's a lot of programs, there's a lot of ways to get it. And so I don't want to deter anyone, you know, from trying to access these programs if they don't have Medicaid. Just just refer them to an IL specialist because we can usually work out some of that. And so the Department of Health and Human Services in Montana has a home health care program, and it's called Community First Choice. And it's a personal assistance program. It helps people with things like meal prep, transportation, bathing, dressing, eating, basically any activities of daily living. And then under this realm of community first choice, people have two options. They can go agency-based, where an agency will send employees that the agency has hired, that they have trained to provide the personal assistance. One of the benefits of this program is that if a worker doesn't show up, they can send another staff member. One of the cons of this program, though, is that people have less choice on their schedule, and sometimes they may not know the person that's coming into their home. But it can really work for people who don't have, who like don't know anybody or don't have a lot of informal support. And then there's the self-direct option, which is my favorite because the Centers for Independent Living offer this option because it really aligns with our core values. And so self-direct is where the person with the disability, they direct their care. They hire who they want, who they're comfortable with. They train their own employees, their own staff. They create their own schedule. They get to make a lot more choices in their day-to-day lives with this program. But one of the cons with this program is that, like, if they don't have adequate backup plans or they don't have a couple caregivers for backup, if someone calls off, they can be left at risk. And so we really try to work on those plans with people so they're not stuck in a situation where they aren't getting meal prep that day or important services like that. And so the Community First Choice program, it covers a lot of basics, but it doesn't cover everything. And so people may need a few more services to be successful in their homes. When we see this, we refer them to one of the Medicaid waiver programs. This can be a really good way to, support people, like good wraparound services. They can help with a lot of different things that Community First Choice can't. So they can help with like professional case management, nutrition assistance, more personal assistance hours, like for social time. The waivers can help with home modifications. Like if someone needs like a walk-in shower or a ramp, the waiver program can help pay for that. They have other services like a homemaker chore, where they'll pay a company to come in and help a person organize or carry off debris, that can pile up when people, don't feel well enough to, or just unable functionally to be able to haul things away. And there are many types of waivers. A couple that we work with all the time and provide services for are the SDMI, which is severe disabling mental illness waiver. And then there's the senior and long-term care waiver, or the Big Sky waiver. And they just can help support people in the community as well. And really, the best way to access any of these services for people, if you see people in the community that, you know, just seem like they need help, refer them to us. We're nonprofits. So like, even if they need services that we aren't necessarily providing, like we will help get people where they need to go. We want people with disabilities to be living in the community. If that's what they choose, you know, we can provide a lot of services to help prevent nursing home placement, you know, or transition people out, you know, if that's what they want, because, you know, we support choice. And yeah, if anyone has any questions about these services, just, I would say contact us, because we're more than willing to talk about them. And that's all I have on that. So with that, I will give this over to Bronwyn.
Hello, again, I'm Bronwyn Troutman from Summit in Missoula. And much of the work that I do is providing housing information and referrals to individuals with disabilities. But really that is just a small part of the housing advocacy work done at Centers for Independent Living. And like Allison said, often we'll be contacted directly by consumers who are living in institutions such as nursing homes, hospitals, mental health group homes, or mental health institutions, and they will ask for our assistance with their transition. And so the first thing is always housing. Like, okay, how do we find housing for people that their only income might be SSI, which, like Travis said, is $790 a month. So it's a big challenge, as we all know. So I wanted to go over some important housing programs that we have here in Montana, which I think most of our audience is going to be familiar with some of these, such as Section 8. So these programs, Section 8, public housing, 811, and the mainstream vouchers, make housing affordable to very low income individuals. In that usually you pay around 30% of your adjusted monthly income. So it really makes it possible when it would otherwise be impossible to afford living in the community. Most of us are familiar with Section 8. It includes property-based Section 8, where the subsidy from HUD, the federal money, goes directly to the property and is attached to that property. And then the housing choice voucher, which is kind of like the golden ticket, is where you can rent from a landlord who accepts the voucher. So it gives you a lot more choice. The problem with those vouchers, even though they're great, is that the waiting lists, as we all know, are extremely long. So between 1 and 5 years. And I also wanted to put public housing into that. So the 811 and mainstream vouchers are lesser known programs, but they are specifically for people with disabilities. And they work very much like property-based Section 8, where the funding is tied to a specific unit. And those are, they're mixed in with other units. So it's not just like, this property is just for people with disabilities, it's like mixed in. In order to meet the criteria for the 811 and the mainstream vouchers, you have to have a disability and you have to meet the strict eligibility criteria. So I wanted to talk a little bit more about the 811 voucher program, a little bit more in depth, because this is an important program for individuals with disabilities who are eligible for some of those any of those Medicaid waiver programs. And they are referred to the state through the home and community-based services, Medicaid waiver teams. So in order to be referred for the 811 program, you have to be eligible for the Big Sky waiver. So for those with significant mobility impairments or physical disabilities, the DD or developmental disability waiver, which is also known as the 0208, Medicaid waiver, and then there is the SDMI waiver, as Allison mentioned, for individuals with mental health disabilities. So when we talk about disability, we really include a wide range, all types of disability. So for this, for the sake of time, I'm going to talk about this slide. And I wanted to share some data here provided by Diana Culver-Bennett with Montana Housing. And so this map shows the number of rented units that are being used by 811 voucher holders. And so it really, just to be save on time, it really shows that only 20 out of 122 units are being used by 811 voucher holders right now. And so this program is underutilized. And a lot of the units are not accessible. And so they may be referred by people that have physical or mobility impairments, but those people have to, when they're offered a unit, they have to refuse it because the units are often on a second floor with no elevator, or they're just not going to work for someone who maybe uses a wheelchair or another mobility device, or just can't do stairs. And so it just really shows that there is a lack of accessible housing for people that are in desperate need and really want to live in their community. And then I think the other gap is that many of the mental health case managers don't know about this program. And so I think it really shows an opportunity to ask, why is this program so underutilized when we have so many people in desperate need? And then the data shows that we need more affordable housing that is accessible, but we also have an advocacy opportunity to work together to ensure that our most vulnerable population, disabled Montanans, have access to accessible and affordable housing. And so I think with that, I'm going to pass the baton on to the next speaker. Thank you.
You're up, Charles.
Hi, I'm Charles Alvarez. I work for Montana Independent Living Project as well. I'm a independent living specialist and certified behavioral health peer support specialist. And first of all, I'd like to talk a little bit about the independent living philosophy and the movement. And it was founded in the belief that people with disabilities, regardless of the form, have a common history and shared struggle. It emphasizes on consumer control and the idea that people with disabilities are the best experts on their own needs. So like with Montana Independent Living, who I work for, what we do to help out, I mean, 51% of our employees have a disability of some sort, as well as our board members. So it's for people with disabilities, run by people with disabilities, and most of the all CILs are run like this. And I'm going to talk a little bit about peer support. Also, just with experience with being homeless, stuff like that, you know, we go out, we offer a helping hand, you know, and just listen to people, you know, and listen to what their needs are. And I like to tell people, you know, when they're coming in and they're talking to me about whether it's housing, jobs or whatnot, but mainly housing, we're there to help find resources. And even though I may give you a resource or some information, you know, I'm still there for you. If it doesn't work out, come back. We're here for you still, you know, we're never going to give up on you. And through peer support, you know, we can share information, people can share their lived experiences, and, you know, like with housing and finding housing and support programs and certain group homes and whatnot. And through that, you know, word of mouth and everything, you can find information pretty quickly, and you know, you always have someone to talk to about it. And then with the VA, we work a lot with the VA, and you know, through peer support and also housing. And what the VA is doing now is VASH, VA subsidized housing. As you can see here, it's a joint program where qualified veterans who would receive Section 8 vouchers are case managed by hold on. are case managed by a social worker and a team of other disciplines. Single veterans and veterans' families need to be homeless or imminent of homelessness and have an income, i.e. job, SSDI, or a service connection related disability. Is there one more slide? Travis?
No, that's it.
Okay. So I have some contact info here for HUD VASH. All you got to do is pretty much call out. Sorry. All right. If you want Jason Bridger, he's a peer specialist at the VA Montana Healthcare System with HUD VASH and all that at 3687 Veterans Drive at Fort Harris, and he's willing to help. He's another, like I said, we do outreach. We have resources, information, and referral. And if you have any questions about that or anything later on, feel free to ask me. I can get you the contact info that you need. So thank you. And I'm not sure if I hit the full 5 minutes, but I get nervous speaking.
Good. All right, Shyla.
Hi, I'm Shyla, and I work at North Central Independent Living, and I'm going to delve into a little bit of the CILs and how we use CARES Act funding and some data and some government speak. So, and the Administration on Community Living, which oversees our nationwide CIL network, contacted many of our CIL directors regarding COVID-19 aid and relief and the CARES Act, which President Trump signed into law on March 27th, 2020, at the beginning of Montana's stay-at-home orders. For here in Montana, nationwide, the CARES Act provided $85 million in supplemental funds to centers for independent living all around the country to directly respond to the COVID-19 pandemic. And the ACL, which is the Administration on Community Living, started to distribute that in April of 2020. And the mission of that CARES Act funding was CILs were directed to utilize the entirety of the funds to respond to the COVID-19 pandemic and the surge of needs of individuals with disabilities to access or reconnect with services they needed to remain safely at home. Many of us have heard about stories in Montana regarding the COVID pandemic and congregate settings or nursing facilities, and the ACL directed all CILs to focus on helping people with disabilities to meet basic community needs that were not being duplicated by other agencies. And so Montana received $941,245, and our centers and staff really value the partnerships that we have with and regarding transition and nursing home diversion. As many of the speakers before me talked about various programs that we use during the normal times, such as Money Follows a Person and the waivers, the CILs the Montana CILs really decided to focus on helping those Montanans with disabilities who needed services that they might not get quickly enough by the waivers or different community agencies to stay in their home. And according to our data that we provided to the federal government, from April of 2020 until the present time, we have served approximately 175 Montana consumers who are at risk of going into institutional settings. 7.4% were children and 67% were adults with disabilities from the age of 20 to 63, 64, and about 25% were at risk of going into, or were seniors, and people with disability were seniors as well. So
Shyla, can we skip ahead?
yeah, sure. And so one of the things that we really tried to focus on is nursing home diversion, and we have several success stories. One of our centers was fortunate enough to help a couple of their people move successfully independently by helping with deposits, last month's rent, and making sure that eviction things were expunged off someone's record. And it's been really beneficial to that person, because that person was going to go to school in our at one of our major universities. We have also provided assistance for ramps and home mods where needed, and different types of opportunities for staff and consumers to connect with our consumers during the pandemic. One of the things that we'd like to let you know is that the CARES Act and the ARPA funding is a temporary solution. So we are advocating for certain policy opportunities, and I'd like to pass the baton onto Anaya Robinson, who will explain what the partner CILs are doing in Colorado. And they have some really grand opportunities that I think Montana can take advantage of.
Thanks, Shyla. Hey, y'all. I'm Anaya. I'm the Associate Director at Atlantis Community down in Denver. We were the third CIL in the country, the first one in Colorado. We've been around for 46 years and started out as an organization doing transitions and getting people out of institutional settings. I'm going to try to talk really fast so that there's still time for questions. So back in 2014, CIL'S and ADAPT here in Colorado lobbied our state legislature to get state funds to create vouchers for Our Money Follows the Person program. And then in 2018, we moved Our Money Follows the Person demonstration grant into our Medicaid state plan to sustain it. And we were able to sustain the funding for those housing vouchers in that legislation as well. So we continue to have access to those transition housing vouchers. The good thing about those vouchers is that they're not HUD funded. So we have a lot more flexibility with those vouchers than we would if it was federal funding. We don't have to require background checks for people to access these vouchers. I think, as we know, a lot of folks coming out of institutions have history with substance use or some things on their backgrounds that might preclude them from being able to access a HUD voucher. We were able to mitigate that issue by not requiring those background checks. We have a lot of flexibility in the way that we use these vouchers in the areas that we can. Part of the language in the legislation was not only for transitions out of institutions, but also for diversion from institutional placement in the first place. We're also able to have our Colorado Division of Housing pay for the rent deposits when those vouchers are being used. And then a couple of things that we were able to do in Colorado in the past couple of years as well in regards to vouchers is in 2019 or 2020, sorry, we passed a bill that allowed us to statewide look at housing vouchers as a source of income. So landlords in the entire state of Colorado now are not allowed to turn somebody away because they are using a housing voucher as long as the rent amount is within that payment standard. Landlords have to accept housing vouchers now. And then this legislative session, we were also able to pass a new bill that allows folks who are undocumented in the state of Colorado to access state-funded housing subsidies as well, which helps out a lot of the folks in our community. I know you've heard a lot about the CARES Act dollars and transitions during COVID. And in Colorado, over 30% of COVID deaths in our state were in nursing facilities. And less than 0.5% of our state's population live in nursing facilities. So those numbers don't work out. So we created a partnership with several other organizations in the state and some state departments to create an emergency transition program using some of those vouchers, those state funded vouchers we were able to get. So we are moving folks out of any type of congregate setting. So nursing facilities, assisted livings, congregate shelters, hospitals, into hotel rooms. And I know there was a question earlier about workforce issues and finding people to provide services to individuals in the community. We're partnering with a group called the Reciprocity Collective that does employment support for people experiencing homelessness. And they're identifying folks and working with a couple of our, some of our consumer directed agencies in one of our consumer directed hybrid options, and hiring those individuals who are experiencing homelessness to provide care to the folks that we are transitioning and diverting. And they're also moving into the hotels, which helps create kind of a community structure in that space while they're there, and also gives the folks who are currently unhoused the ability to have income for 1 or 2 months with no living expenses, so that when we transition our folks into their permanent housing with their vouchers, their caregivers are also able then to afford to house themselves. So we were really trying to bridge gaps for a lot of folks that the pandemic hit the hardest, and provide support in different ways for those communities as well. And I
Is that
think
it?
that's good. Yeah.
Okay, sorry, I wasn't advancing slides
No
fast
worries.
enough.
No worries. I was just trying to get through it.
Okay, so yeah, thanks everybody, and sorry we kind of went long. I think our PowerPoint is available for download on the presentation page on the Whova app. There's a list of some resources here, and I think that there was one question, if we can get to it real quick. It is, do you have any recommended talking points or ways to suggest a person may benefit from in-home services? I work in subsidized housing and get calls from landlords when a tenant is at risk of losing their home due to a lack of hygiene or losing the physical ability to clean their home. You seem to get a 50-50 result. Either they show willingness to look into it or they are offended by the question. Does anybody want to take that question on?
I think Allison might be the best qualified.
Hi guys, this is Allison. Well, it's hygiene and the way people's houses are is a sensitive issue. And to me, when like people that don't understand me or like they just seem very professional and they're trying to tell me what to do, it's like I get sensitive. And so I'm almost thinking that this is like a peer support. In the peer support realm, it's almost different when you have like someone else who identifies, to come in and maybe talk about some sensitive issues. And so I would almost say, call a peer support specialist at a CIL, someone who is good with talking to people about this kind of stuff. And then there was another question that felt in my realm from James. An issue that one of my clients is facing is lack of caregivers and PCAs. I have been told by an agency that there is a nationwide lack of PCAs and caregivers. Have you heard of this being a nationwide concern? And I don't know about the whole nation, but I do know in our service area, lack of PCAs is a definite issue. And I really believe it has to do with our wages. It's just not enough to be competitive with other jobs. And personal care assistants can be, it's good work, but it can be hard work in a way too. It's maybe not for everybody. And if they can get paid a little bit more, I mean, working somewhere else, they might. So to me, that's
That,
the issue.
yeah, this is Travis. That is one of the drawbacks. I mean, wages are dependent on state funding, and if state funding's not there, wages can't increase, or that they remain the same over several years. So there's really no incentive over the years for people to continue working. So a lot of people move on. And then just going back to that first question, I just wanted to add to Allison's good answer that, yeah, I think you want to be honest and direct with the person and let them know what their responsibilities are. But at the same time, you want to be sensitive to where they're at in life. And I think Allison brought up a good point is reach out to your Center for Independent Living, see if they have some peers that could assist in that process, or maybe refer that person to a Center for Independent Living, and a center can work with them in that capacity to kind of to know what their responsibilities are and help them work towards achieving those. We are out of time, it looks like. So I want to thank everybody for attending. I want to thank all of the presenters, and I want to thank the Housing Partnership for having this conference and allowing us to speak a little bit on people with disabilities. So everybody
Can
have
I
a
just
good
say-
afternoon.
Can I say one thing real quick to answer to help with that first question? It has to do with peer support and all that and hygiene. Sorry, I was trying to get attention, but I can't see my hands when they go up in the air with my background. Real quick, I do help with advocacy and stuff. I've sat down with people and their landlord and them personally. I guess we're out, right? No?
Keep up.
Okay, I've sat down with them and their landlord personally, and after talking with both of them one-on-one and came to an understanding, and I've helped mediate those kind of situations, and I will help them both understand where they're both coming from. I've done it with jobs, with employers and employees. Also, I've gone to a couple of places and mediated and advocated with landlords and tenants numerous times, actually. So yeah, feel free to reach out to your independent living center, to a independent living specialist or anyone, and like I said before, if we can't figure it out, we'll stick with you until we do figure it out.
So thank you all for joining this session. And this is a great conversation, and this was so much information. There is a community conversation in the Whova app. So I think that'd be a great spot to keep going and post some more resources if possible. And the PowerPoint is there for download. So I guess there's a break now, and everybody's going to return to the next sessions at 2:30. So thank you to the presenters, and thank you for everyone who joined us. So have a great afternoon, everyone.
Thanks, bye.
Thank you.
Bye.
Thanks, guys.
Bye.
Thank you.